Thank you for joining me. I'm Juan. In this video, we're going to talk about some special functions that can be found on the LTV1200, some alarms, and some of the solutions for those alarms. You're going to want to watch this video. Okay, so now let's discuss some special functions. Let's go ahead and turn it on. Same patient. Let's do a new patient. Let's do an adult. Let's decrease this tidal volume lower because my test lung is small and I'm going to keep getting alarms. Okay. So now we have our happy settings. If you wanted to lock this so that there's no accidental press, all you have to do is press Control Lock and wait a few seconds. Okay, so now that we set it up, let's go over a few features. So the first one is Control Lock. So to set the Control Lock, you have to press the Control Lock button and wait 5 seconds. Okay, you see the Control Lock button now is stayed on. Now if you press anything, it's going to say locked. Okay. To unlock it, hold it. And now it's unlocked. Some of the displays that you're going to see, you'll see PIP, which is the PIP, peak inspiratory pressure, measured during inspiratory phase. It's not updated during spontaneous breaths. The MAP, you see there, displays a running average of the airway pressure for the last 60 seconds. It's going to have a display for PEEP. It'll display the pressure in the airway circuit at the end of exhalation. F is going to display breath sounds per minute, includes all breath types. VTE displays the exhaled tidal volume as measured at the patient's WIE. VTE is the exhaled tidal volume. And VE is the displays the exhaled tidal volume for the last 60 seconds as calculated from the last 8 breaths. So again, you want to take a look and make sure that the tidal volume matches what you set. If not, you can compensate by adding more tidal volume until the displayed amount or what's actually being administered matches what you're trying to give. So right now the VTE is 149, which is the tidal volume that is being given. So I'm at 170. If I really want 170, then I can increase it by 21. That should get me closer to 170 because it's at 141. So let's go to, let's say 195. And let's see if that should, see there, it got us closer. Now it's at 162. So we can increase it a little more if we really want that 170. So let's increase this to 200. And let's see what it calculates up to now. Okay, 173. Okay, so also IE displays the ratio between measured inspiratory time and expiratory time. IE Calc displays the ratio between the set rate and inspiratory time. VCalc is based off tidal volume and inspiratory time settings. Okay, so now let's take a look at extended features. To get to extended features, we have to hold the select button for 3 seconds. Okay, so we have alarm, SBT up. These are all the extended features. So let's go to vent operations. And if we want to do O2 conserve, we can do O2 conserve here. You can conserve on. It also tells you here how much you have left in your tank. O2 cylinder duration. So cylinder type. Click on cylinder type. Size, liters. So to find that out, you would have to just kind of Google and it'll show your tank and you can kind of see how many liters. So the D tank has 425 liters. And a large M tank would have 3,455. So we would find out how much, calculate, and it'll last forever because we're on 21% oxygen. Then if you want to exit out of that, just hit exit. Now you're out here. You can hit exit. If you're trying to conserve oxygen, you can hit leak compensation off. You can set the date, set to today, year set correctly, month is correct. Okay, so exit out of this. So that's vent up. That's it for just some basic settings, just to have an idea. O2 conserve is important. Control lock. There'll be a link for the manual. It'll be on TraumaSoft. You can access that. And just make sure you're familiar with the vent. Okay, thank you for watching. See you on the next video.